Hi everyone, this is Dr. Korous and this is Sweet Caitlin here today. Today is our fourth episode of Tea Time with Dr. Cam. We're so excited to have you as our guest.
Why, thank you.
I appreciate it so much. And she actually has brought in her daughter Eloise to go through through treatment, and also a second daughter for expansion and airway. So, but I want you to tell our audience why did you seek a dentist who was a little bit different than your current dentist for treating Eloise, and what were the issues or concerns she was facing that you noticed even at birth, but later on developed to bigger concerns for you that you thought it would be a good time to address it, and how do we go about doing that for you?
Sure. So we've been at this practice since my oldest daughter was 6. But
And how old is she now?
She's 9.
Oh, good. So 3 years.
So it's been a journey over the last 3 years. But so at birth, we noticed right away the nurse at the hospital who was cleaning her up like 2 minutes after she came out of me was telling us she has a heart-shaped tongue. You need to talk to your pediatrician right away. She has a tongue tie that's extremely severe. And so, we're new parents. I've never heard of such a thing. Had no idea what was going
on. What's a tongue tie?
Yeah, what is that going to do?
Yes.
But then we looked at her and her tongue was literally heart-shaped. She had a tongue tie to the very tip. So she did not have normal function, and that immediately affected how she could eat.
Yeah.
And so we had our...
Did you have any breastfeeding issues?
So many. Oh my God. It hurts so bad. They gave me a shield at the hospital because she could not curl her tongue up or extend it past her gum line, which is critically important for breastfeeding. So she was just chomping her hard little jaws like this. And so...
And how often, in what period of time did you have the tongue released?
She was released at 24 hours old.
24 hours old.
So, still in the hospital by an ENT. Mm-hmm. And that was, as far as we knew, that was all we needed to do. No one gave us any other instructions. She left the room for 5 minutes with my husband. She came back. She nursed, and we thought that was going to be it. But it very clearly wasn't.
Because nobody mentioned, like, hey, you need to do certain exercises for her so that the tongue doesn't reattach practically or basically. And
exactly.
So how did her journey go all the way to age 6? So what did you notice in her, maybe in her speaking, in her, sinuses, on her, day-to-day activity? Did you notice anything different about her? And what made you concerned that, hey, there might be something deeper than that?
Mm-hmm. Well, after the release, it took about 6 weeks till I felt like she started to eat with less pain for me.
Yeah.
But it took months till she could hold a pacifier in her mouth. And we tried every bottle on the market. I am not even kidding. I think we went through at least 9 until we found one that she could kind of use under duress. She hated it. She wanted nothing to do with the bottle, but at least we found that she would take a Dr. Brown's. Mm-hmm. But we tried so many other ones. And she was so gassy because she had swallow issues she was not forming a good latch. So she would swallow a lot of air, and then it would take 11 years to birth this child till she was comfortable lying down again. So that was tough. And then once we introduced solids, she struggled
with solid food.
She wanted nothing to do with purees. And it wasn't because she didn't like the flavor. It's just she didn't know what to do with her tongue to actually swallow it. Yeah. She would just thrust it back out. Yeah. And normally that's supposed to go away around 6 months of age. Not my child. Not at all.
So you think maybe potentially because maybe it wasn't released as much, or potentially because of the exercises were not done, and that's why you were suffering is still up to 2 months with the breastfeeding. And it's really important that we as providers pay attention to those symptoms, because once we do a release, we want an immediate relief for the mom. And if the immediate relief is not there, like I'm talking about literally for the minutes of the child latching, and if they're not feeling comfortable and we still need to do a little bit more release.
Yeah.
But I always, like even with, kids that come to my practice, before I do the release, I actually have the mom do certain exercises a week and a half prior to the release.
Which makes total sense because, I mean, the tongue it's a huge muscle in your face.
Yes.
And muscles require training. And muscles require
there we go.
support to be used correctly. There's right ways and wrong ways. You can lift weights wrong and build your body. It puts stress on your body if you're doing it wrong. But if you're not doing it at all, it doesn't know how to do it. It's called
a lazy tongue.
Yeah. So Eloise always had issues. She, for the longest time, we were very worried. Most kids have a few words by 12 months. They told us 3 words by 12 months and 20 words by 18 months. And by 15 months, she had, I think, 4, maybe 5 words. And they were all kind of very similar. None of them were mama.
Yeah.
That was fun, but she was making sounds. She babbled, but we weren't yet able to
enunciate words
because she just couldn't make the sounds.
Right.
And I was that mom. I was practicing with her. I was trying to get her to do the things.
And I know you're. By the way, I'm gonna give her something because Eloise did go through treatment and she's gonna explain. But she's been a super mom, and because it's important that we get the child ownership into the treatment, because we want to let her know that you're the one that's responsible. But in reality, we want the parents to be a guiding force, obviously, throughout the entire process. And you've been nothing but amazing. Seriously, I truly mean that.
I mean, there's no other way to do it, in my opinion. I mean, kids, they do need to be invested in the process because it is not an overnight fix.
No,
it takes a lot of work.
It does take
a lot of work. Consistency.
Yep.
But for our girls, we've made such a big deal out of explaining the why. Why are we doing this? Well, it's not to torture you. It's not fun to do some of these exercises
3 times a day.
Yeah, but there's a purpose. And we've always made sure our kids understand that we're doing this for a reason. It's to help you. It's to help your face grow correctly. It's to make sure that you can do this. It's my youngest just started her exercises a couple weeks ago. I guess, well, not a couple. It's been a hot minute. It's like we're 6 weeks into the program.
That's right.
But she was in tears that first week because one of the exercises was really hard for her. And now, she's doing it very well, and she's doing it with weights. So it's gotten progressively harder. But we just talked about it today that the first week you thought you weren't ever going to be able to do it with just 1 weight on there.
Yeah.
And now you're doing it with 3 because you got stronger, because we worked at it, and now your face is stronger. Now your tongue is stronger. Now your lips are stronger because we put in the work.
And believe it or not, whenever the patient goes through that myofunctional therapeutic exercise for the tongue and the facial muscle, I know your little one, she was experiencing a lot of asthma and congestion and allergies. And so when her tongue gets stronger and stronger, it allows her for her tongue to be at her roof of the mouth, which then allows her to have the correct swallowing pattern, correct breathing pattern. And guess what? Her allergy and congestion goes reduced down over time. Yeah. How is she feeling that right now?
I mean, it's definitely improved quite a bit.
Yeah.
She's my 5-year-old.
Now we're talking about the second child.
So my 5-year-old just started with a myo brace. So because we're starting earlier and her symptoms are less severe than Eloise's, she didn't need quite as extreme an intervention right off the bat.
Right.
So her myo brace, it's, I think, silicone.
Yeah.
Right? So it's soft, and she can pop it in and out versus a fixed appliance that Eloise had. But, at first it was really hard. She couldn't keep it in all night.
Yeah.
And
I said for 3 weeks it's going to be like that.
Right. So we would go check on her and make sure it was in there before we went to bed. And we ask her every day, okay, is it in your mouth when you wake up? And at first it was like, no. I woke up and it was next to my pillow. Yeah. Or it was on the floor. Yeah. But, we've just been consistently working at it. And now she's waking up with it in her mouth like she's supposed to. And it's definitely already
because we discussed
starting to make a difference.
We discussed that within the first 3 weeks, she's going to take it out. She's going to wake up with her on the floor or on the pillow. But you have to be consistent, and you say it's okay, and you end up putting it back in the patient's mouth so she can continue.
Yes. And if she does wake up at night and it's not in there, she has told us, oh, I found it and I put it back.
There you go. So she's learned.
She's learning. Yeah. And, it's still I feel like pretty great that a 6-year-old, 5-year-old, she's going to be sick in a couple of weeks.
Yeah.
But, you know, she's has that ownership of the process. Like,
there
okay,
you go. Ownership.
I'm going to put it in. This is for me.
Yes.
She's not getting away with anything. You know,
exactly.
like, we wouldn't know. I'm not going in there at 3 a.m. Like, but she'll put it back. If she wakes up and it's not there, she puts it back. But she does want to feel better. And she is breathing better. I've noticed she's less stuffy. Because when we first started, one of the reasons she is a mouth breather is because she's too stuffy to breathe through her nose all night. But it is improving.
Yeah, and the reason, again, great example. You said she takes her own ownership, right? She comes out of her mouth, she puts it right back in, and she then reports to the parents the very next day, hey, I did that. And that's really important because now she's realizing, okay, she took ownership of the appliance and doing the myofunctional therapy. And as you're saying, she's getting better and better with her sleep, with her breathing, with her oxygenation, and decrease her asthma. Now let's go back to Eloise.
Sure.
We talked about when she came in, she actually had what was going on with her front bottom teeth.
Okay. And yes. So that was kind of what took me to you. We had a different dentist, and I just didn't feel heard. You know, that we had these issues that were still persistent. You know, we thought we would outgrow over time because, you know, while we would hit milestones later, you know, Eloise did start talking, but it took longer than expected. And then, of course, she was eating fine by that point, but it took longer than expected. And, you know, she spoke a mile a minute, but I was the only one who could understand her. But, you know, here we are in kindergarten.
She had difficulty with enunciating things, words, because of the tongue restriction.
Well, and like some of it was adorable. Like instead of calling, you know, in just the way that kids do things, right? So instead of Snow White with a T, it was Snow White puh.
Okay.
Like baby wipe.
Yeah.
So it was Snow White in our house because that's the sound she could make.
Yes. Because of the tongue restriction.
Exactly.
Yeah.
But that gets cute when you're 3, but it's less cute when you're in kindergarten and you're like, we should be doing better with this by now. And the kindergarten teacher is telling me that sometimes she has to ask my daughter multiple times what she said because she knows my child is literally gifted, you know, and had been tested. So her front teeth came out, and then her big teeth start coming up, and they're set back very far in her mouth, and they're at a very severe angle. Mm-hmm. And I was just like, oh, that's not how teeth are supposed to look.
No.
I might not be a dentist, but I know that wasn't right. And so you had come up multiple times in a Facebook group that I'm a part of, Ladies of Little Elm, which sounds so ridiculous when you say it, but you know, it's nice to have an online community of people in your area.
Exactly.
And so your name had been recommended a few times in there, and I was like, you know, let me see about this. Let's go to somebody who might have a little bit more expertise in, you know, peculiarities, as it were. Within 5 minutes, you know, Lindsay had looked at her mouth. Dr. Park had looked at her mouth. Yeah. I was like, we need to have a conversation about what should be done because she's got a lot of issues. Yeah. And once we saw, you know, I authorized her x-rays.
The CBCT, which is like a 3-dimensional x-ray of her head. So we can look at the airway, the nose,
that was
soft palate, the tongue.
That was such a heartbreaking moment for me because you know you want what's best for your kids, and then you see the literal inside view of your child's head, and you're just like, oh my! I mean, not a medical professional, but I'm also not an idiot, and I could look at this and be like, that isn't right. Yeah. And her sinuses were clearly the wrong size, and her jaw was set so far back.
Yeah.
She had such an undersized lower jaw, and you could just see from looking at her x-rays, like even the tilt of her skull wasn't straight on her spine. Her head was like this because it was being pulled back by her tongue.
And not only that, her body, and interesting to notice that. Yeah. Very, very interesting to notice that. She said her head was tilted. You know, the body is an amazing machine. It actually will find a way to compensate for airway deficiency. So the fact that her spine, her jaw, her neck was a little tilted as well, because when we put the patient in the CBCT machine, we'll say, okay, sit up straight, don't move, and we take a CBCT around the head. But in reality, she was position. Her neck and head was positioned in a tilted position because that was the way that her body could breathe. It was finding a way for her to breathe and oxygen, during the day and also at nighttime.
Right.
And that is one thing again, you notice, and I also pointed out, but more importantly, how much her jaw was set back. And do you remember how much? So initially, when we took the CBCT, the before and after, within March till December of 2022, within 6 months of treatment, what happened to her jaw and her chin, and how much it came forward without any jaw surgery, with expansion myofunctional therapy, and how much her jaw changed. And I remember telling you, and I said, hey, she has big sized teeth. And then you said, yeah, she has my jaw and her dad's teeth.
And my girls have definitely a smaller face, but they have these giant teeth stuck in that poor little face. And I was just like, there's not space for these. No. Especially, we at that point for both kids, we're looking at just 2 adult-sized teeth when we were making decisions. But it's like, you can already tell those suckers aren't going to fit in this teeny little face.
No, for sure not.
And I'm just looking at Eloise. Oh my goodness, the size of her first expander. It was just the teeniest little thing. And we maxed it out. But she had to go through 3 different sets of expansion to get to a normal size.
Yeah.
But when you look at how tiny, we still have it at home. Yeah. Look at how tiny her maxed out expander was from when she was 6 and 7 to the Invisaligners now that she's just finished up with. Like the width of her mouth is just a dramatic different shape.
Interesting you say that, because she actually went through the 3 set of expansion, because she literally would max out the set of expanders, and I'm like, we still need more room, because I would see the adult teeth coming in and they didn't have a space. So when I'm like, okay, we need to expand her more. And the interesting thing is that when we do expansion, we do it with laser treatment, because she has no pain. Because whenever we go through the expansion, we make sure the palate, the suture gets lasered, so as the outside of the root of the surface of the teeth and the inside, and the same for the bottom teeth, because we want to make sure we are developing bone as we're expanding, because we don't want the root surfaces to come out of the bone or the socket, because we want everything to be developing and get into the maximum capacity of where she needs her jaw position and teeth position to be.
Right. Oh, and that's why we thought this made so much more sense. It's a big shock when you're sitting down and you're going over the treatment plan, and like, we knew our kid needed this. It's not just aesthetics. Like, I had braces, but it was just because my teeth were crooked as far as I knew. Like, okay, let's give you a prettier smile, but this is not about that. Like, her skull was growing wrong. Like, how do you, as a parent, look at that and say, I'm not going to do anything, right? Like, for us, it was like, we're going to find the money and we're going to fix her face, because this is going to affect the rest of her life. Yeah. But a 6-year-old still has malleable bones. Yeah. Everything's growing anyway. Yeah. So for us, it was like, we need to do this now while they're little, because their face is already growing. Correct. Every year. Let's make sure it grows in the right direction.
Let's make smart mom.
Let's make sure it grows, encourage it to grow more where it needs to grow and in the right shape.
Yes.
So, by the time we're 13, 14, when we were doing braces in the 90s, that doesn't make sense to me anymore. That was a norm then, but it doesn't really, when you know enough about human anatomy,
exactly,
we can do so much more now, less invasively, with less pain. Right. I mean, it's just, and it's so much easier to just do it now.
Correct. And I know your dad is an oromaxillofacial surgeon, and I know before she started treatment, her dad had mentioned, hey, why don't you just wait, and she's 21 and do the jaw surgery. And she said, well, I don't want a jaw surgery for her later on in life, and I want to treat this holistically. And I know you took pictures of before and after.
I loved that part. Yeah.
And to show it to your dad, which is a surgeon, and that's what he does. What did he think of the x-ray? I'm talking about the jaw position and how the chin came forward without having to do any jaw surgery. And what did he see? What did he think of it? What did he mention?
It made such a big difference. I mean, yes, my my dad was an orthopedic surgeon, and so he knows bones, but yeah, he was very much like, she's so little, like, why are you putting her through all this now instead of waiting till,
She's older.
if it doesn't catch up, you can just do surgery
Yeah.
when she's an adult
Yeah.
and leave that up to her kind of thing.
Right.
But when we showed him, we
In
went
6
ahead
months.
anyway. We went ahead anyway.
Right.
I didn't feel like that was something I could sit with, was
Yeah.
waiting
Yeah.
20 years. So we showed him the side by sides of her before and afters, and yeah, he was very taken aback by what we were able to accomplish in such a short amount of time.
6 months to be exact.
Yeah, like March to December,
Yeah.
how much of a difference it made. And just the placement and literally the tilt of her head,
Yeah.
she was able to straighten
Upright.
her skull all the way back. And, this is a child we've had in gymnastics for years too. So it's not like she doesn't know what straight means and what
Yeah.
it's supposed to look like.
Right.
She physically couldn't.
Yeah.
Until we were able to release,
To open up her airway.
and let her sinuses grow. Like there just wasn't space for everything.
No.
And once we made those changes, her
posture
changed. Everything. Her posture changed. Her skull started to look like it's supposed to instead of collapsed inside.
Yes. Yeah.
It was tilted correctly on her spine.
Yeah.
She finally had a more normal look. And I mean, I know now it would even look
She's
quite
gorgeous,
a bit different.
by the way. She is gorgeous. I mean, look at her mom. I mean, but definitely she had a huge improvement in her.
Yes.
She came at least 7 to 8 millimeter. Her lower jaw came forward
quite a bit.
Yeah.
And the expansion out as well. And her nose was starting to look a little funny when it wasn't growing forward.
Yeah.
She was still kind of
flat.
She had a toddler nose, but starting on a little kid face, and it just wasn't catching up.
Yes.
So you could see it kind of being collapsed down
because
when we first started, because all of that's affected by the strength of the tongue.
Yeah.
And so once we were able to release her tongue, we did 3 different tie releases for Eloise. About 6 months into her treatment, we did her releases. Yeah. But she had done all the myofunctional therapy.
Yes. And she was ready.
And yes, so she had done so much work.
Yes.
And then we consistently did the exercises that you gave me after she had her releases. Yes. So it healed correctly.
Yes.
I mean, she's a whole different kid.
And not only that, she's talking about her nose, because believe it or not, when we actually expanding somebody's jaw, and I expand as young as 4 years old to as old as 78 years old. I have patients in all ages in the treatment, because, there is this belief that, maybe you're not able to expand someone at an older age. No, you can't. It takes longer. And then instead of expanding the child every week, we expand the adult every 14 to 21 days, depending on each person.
That is different. Yeah.
So it's 2 or 3 times as longer. However, it still can be done. But most importantly, whenever you actually, expanding someone in the top or the bottom maxillary mandible, we say, you're actually changing the sutures of the brain. There's 9 sutures of the brain that are connected. So when we start expanding her nose, which was tucked in and sit back and maybe make her face shorter, and maybe more, this way, wider, then she became a little bit more of a normal. I mean, she was already pretty, but more of a what she's supposed to look like. And we started expanding her, and she got a little bit more of a cheekbone, because now her skull is coming out.
And her eyes. So she'd always...
I said her skull. Right, what I meant was that her expansion is coming properly, and so she's getting it more...
Her eyes opened up quite a bit too, because of the spacing change.
Right, because everything's not tucked in.
Yeah, because when she was really little, I swear, when she was born, it took us a good 6 to 8 weeks to even figure out what color her eyes truly were.
Oh my gosh.
Because she could only open them such a teeny little bit, because she had massive chunky cheeks, but also just everything was set back so much further than I think it's supposed to be, because the shape of her face was just, even from how it had developed in the womb, was just restricted by that time.
Yeah.
So
and several years ago, 50, 60 years ago, when they changed the food chain, and it was, it used to be fat on the top and sugar on the bottom, and then now everything got reversed, and there's sugar introduced to every product that ever exists on the face of the planet. And so I mean, they've done research studies on people like from different countries, and they have wide arch forms because they have no processed food or sugar. And sugar has become one of our greatest weakness in the society because it's, believe it or not, is one of the most addictive drug. And we all love
absolutely.
it. But depending at what age it is to choose, how it impacts the mother's body and genetic and makeup, and how it actually impacts the child's during the developmental ages in the womb as well, believe it or
Yeah.
not.
Well, and as far as a know better, do better thing, I mean, I took prenatal vitamins with both my children, but when Eloise was born with, defects
Yeah.
in a way, I did change my prenatals between girls. So by Margot, I used a methylated folate. I didn't know that was a thing.
Oh my
I just had regular B12.
Oh my god!
I switched to one with methylated folate.
Yes, because that's the only way that actually can get absorbed. If you take the regular folate, acid, and it's not a methylated form, about 40-50% of the population actually cannot absorb that properly.
And so many different cranial defects are linked to folic acid absorption. So
I didn't know you had that switch.
I did. And Margot, I knew immediately as soon as Margot was born and we had that first latch, I was like, oh, that's what it's supposed to feel like. Because she immediately knew what to do. And Eloise would take 45 minutes to nurse, and it was so painful the whole time. And Margot, 10 minutes, we were done. She did not. It was easy.
Yeah,
I was like, this is what it's supposed to be like. Oh, okay. I mean, she still does have a little tongue tie.
Yeah.
We're going to work on releasing,
we're going to work on releasing.
Not nearly what I experienced with Eloise. Yeah. And I certainly think it made a difference. Like, she hasn't had nearly the issues.
Yeah.
And like, yes, she has asthma, and I've had asthma since I was little, but I think Margot's is more linked to the coronavirus that she experienced twice in the age of 3 before she could be vaccinated. Like, she had no problems before that. Yeah. And then all of a sudden it was like, oh, every time you get sick, you wheeze. Cool.
We're going to fix that problem right now for her.
But she's come a long way as well.
She has. She's breathing better now.
Even just in 6 weeks, there's been enough improvement that
she doesn't have to use the inhaler anymore.
She's not using the inhaler the way she had to before when she was sick. Because that's when her symptoms get worse. Is if she has a virus, that's what triggers her asthma.
And then how often do you have to use an inhaler for her?
She takes it twice a day. But if she's sick, we usually have to increase.
So she hasn't taken it.
She's just taking it the normal amount.
Yeah.
We never had to increase her dosage, and we didn't have to have her on steroids.
That's awesome.
If she starts to wheeze, we have to use steroids.
Yeah. So eventually, like her young daughter who's undergoing treatment with myobrace and myofunctional therapy, and within maybe a month or two, we'll do a tongue release for her. Eventually, the goal is that, I mean, I'm not a physician, so I cannot take her off of an inhaler. But when kids go through treatment, they eventually don't need
That's certainly our goals. If we, it makes sense that she had problems when she was 3. Little kids have such a different body, but as you grow, and if we're able to improve her airways
and breathing,
she might not need it anymore. She might actually outgrow it.
Yes.
So that's certainly our hope that what we're doing now will lead to reduced necessity over time.
And that's what the goal is, because as you're telling me, as she's, Caitlin's telling me, before she had to use, increase the dose of the steroids and all that stuff, but now she's just using the normal dose. And eventually, once maybe 6 months down the road, we would like to assess her where she's at. And obviously, you'll see how much of an improvement she has. Technically, the length of treatment at her age, usually about a year. Eloise was a little different because she was so restricted. Her younger daughter, now she's 9, that we had to go through 3 sets of expanders along with myofunctional therapy and Invisalign. And the reason we had to do Invisalign is because we wanted to align her teeth properly because she had so much crowding, and we wanted to make sure everything gets crowded. Now, Invisalign, like on kids, is different than adults because we don't actually have them wear it, in 21 hours a day. How often did Eloise wear the Invisalign after the expansion and myofunctional therapy?
She was just wearing it at night. So between roughly 8 p.m. and 7 a.m.
Yeah.
So it didn't impact her school life at all, which she was so thrilled about because you said you could have traditional braces or Invisalign.
Yeah.
And she jumped on that Invisalign because, braces still have kind of a stigma. She did not want to be metal mouth anymore.
Exactly.
She plays soccer and she didn't want to have her face cut up if she took a ball to the face.
Oh my gosh. Yeah.
So, she's not something she had to keep track of at school because, kids eat. These kids have snacks at school. They have lunch, obviously.
Yeah.
Like, she's out of the house for,
Quite
10 hours a day
Yeah.
for school-related things. So not having to worry about that while she was at school was so helpful for her. It was just, pop it in, go to bed. Don't even think about it. It doesn't hurt.
Yeah.
She's just, it doesn't change anything about her life.
Yeah.
Except pop in and go.
And go.
And so she's loved having that freedom.
That's awesome. And so she started with a lot of symptoms. Has all her symptoms have been improved?
Everything.
So
she speaks beautifully. She has done a lot better with food too, even because she's learned how to swallow properly.
Yeah.
We used to have to cut her even way past the age most people. Like we've always had to cut her food pretty small. We've had, she had a lot of feelings about meats in particular because they were harder for her to chew and swallow.
How does she feel now?
Girl, this kid will never turn down a hamburger. But
so now she
loves barbecue. She's really expanded what she's willing to. Yes.
Even the texture of the food, because of her improper swallowing pattern of the tongue and the restriction, was impacting her choice of food because she was not comfortable.
And she would beg on things like normal things most kids her age could handle.
Yeah.
She just couldn't do it. Yeah. And I don't think it had anything to do with flavor, but she always struggled with proteins unless they were super soft. So, we're a huge fan of crock pot chicken, anything in my house, because then it's so stewed and it breaks down into such small pieces.
Yeah.
She had no problem with it. But try and give this kid a steak, for years there. We had to cut it into these minuscule, tiny little pieces for her to be able to process it. Yeah. And she eats everything now.
You don't know how the small little things like that actually impacts, the mom, that the way she's actually talking about it, and also Eloise as well. So,
it just, so many things you just, have to build into your day.
Yeah.
Like it does, like my food's getting cold here while I chop every little thing into a teeny little 2-year-old size bite for a 7-year-old.
Correct.
You have to really make conscious choices about what you're packing for lunch. Is she going to be able to eat this by herself?
Yes.
And it just, it does make a difference. And she's, kids want to be independent and they want to not feel like, okay, mom, can you cut my food for me? Like she wants to use a knife herself because she's a big girl now, and those are things you want to build in.
Yes.
Have your children be independent.
Correct.
And age appropriately so.
Yeah.
But, she's so responsible.
Yeah.
And I do feel like part of that has been the training and the regimen of, okay, I have to do my exercises. I need to get these things done. I need to prioritize this in my day.
Yeah.
And get it done. And she did, because Eloise did Myo for 2 years.
Yeah.
Pretty much.
Yeah.
And she took it so seriously for such a little girl.
Yeah.
She knew
because
that it was improving.
Let's give you a little credit because you actually stuck with it and you helped her get through it. And she's now, within 6 months into treatment, her jaw came forward, but then she actually went through 3 sets of expanders. I think anywhere between 14 to 18 millimeter of expansion in her jaw. That's what we were able to do laterally. And also she came at least forward on the lower jaw, 7 to 8 millimeters. So believe it or not, she had a lot of improvement and no symptoms, no allergy, no congestion, no sleep problems anymore. And on top of that, she is now, growing to adulthood, and she doesn't have to go through any invasive procedures, no braces, no having to, we don't extract teeth, but having to have any impaction or anything like that. And her younger sister is also going through expansion, but because she's younger and she came in a little bit earlier than her sister, she's using even a less invasive approach, which myobrace and myofunctional therapy. She still would need a tongue release because of the asthma that she has, which has already improved. But we will be doing a release maybe about a couple months from now because I think that's when she's going to be ready. But again, thank you so very much, Caitlin.
You've changed our lives, and that's something too, that we didn't quite cover. So let me just throw you one other little shout out here.
Sure.
We come here so often, but this place is like a family. Everybody knows my kids, and they, they're treated like people. You guys know their interests. You take so much interest in them. I mean, Susan's practically their extra grandma, because they're not just. I don't feel like we're just a patient you're trying to like treat and get out the door. You guys
are
know
family.
us. You take care of us, on a personal level, not just.
You're so sweet.
We're not just, a number.
Yes.
And an insurance to file. Like, you guys have been so supportive of our journey.
Thank you so much
for our kids.
So appreciate it. Oh my gosh. I love you too. You're so sweet. Thank you so much, Caitlin. I see she's getting a little emotional on the side.
I know. It's like, keep it back, keep it together.
Keep it together.
Don't let your mascara run, girl.
But thank you so very much. I really appreciate you for coming in today. I know you had to wait on me a little bit because I was talking to one of our sleep doctors about actually the very same thing that the kids that he's seeing, he wants to be able to treat them as well. And he was here. That's why you had to wait on us a little bit, but I appreciate it so much. Do you have anything for our audience? Any last bit of recommendation or anything you'd like to say?
I mean, I think just sometimes you have to take the leap of faith, and it seems like a lot at first, but when you commit to the program, it works.
Yes, it does.
And it isn't overnight.
No, it's not.
It's not overnight, and it's not, without a few tears when you're dealing with little kids. It can be a lot,
True fact.
But
a great result
immediately, both my kids have figured out very quickly through the process, this actually is helping me, and I feel better, and I look better.
Within how long?
Well, Margot's only been doing this for 6 weeks. Like, we literally got week 6 today from her Myo appointment, and she's already made the connection. I couldn't do this a couple weeks ago.
And Margot is 5 years old.
Margot is 5.
5 years old.
And she's already figured out, this is easier.
Yes.
I'm doing better with this.
Yes.
Because
she's consistent with it.
Yes.
Consistency is the key, actually.
It really is.
Yeah.
But she understands that, and she's focused on it, and, she can do it.
Yeah.
It helps us to remind her, you can do hard things.
Yes.
And yes, some days are hard.
Yeah.
But we make it work, and we do our best, and it literally, you can look at my daughters before and afters, and it's like, okay,
now things are improving.
Look what we did.
Yes.
Look what we accomplished together.
That's awesome. You're changing their lives. I mean, again, the decisions that parents make at the very early stages of their child development can impact your kids' lives.
Yes.
Eloise and Margot for the rest of their lives.
Right. I mean, there's not much you can do without a lot of pain to fix your face once your bones are done growing.
Exactly.
So it's a pretty big deal.
And this is non-invasive.
But now they're growing. It's not they're growing anyway. So we're just growing in the right direction. So,
thank you so very much
for having me. I'm so glad I could be here today.
Absolutely. And stay tuned for our next episode coming soon. You guys have a wonderful rest of your day, and take care.